All right, so there's this story that we've been tracking quite a bit here at CBSN. The state of New Jersey plans to hold a hearing Monday to discuss what happened at an area health facility, leaving 11 kids dead and more than 30 infected from an outbreak of adenovirus. Officials said all of the children who died had compromised immune systems.
New Jersey's Department of Health found some issues with hand washing among staff, and one former patient described poor conditions, but the center has pushed back, saying that they're ranking in the top nursing facilities in the country. So joining us now is Democrat New Jersey State Senator Joe Vitale, and he's also the chair of New Jersey's Health, Human Services, and Senior Citizens Committee, and you're going to be leading Monday's inquiry. Thank you so much for joining us. So listen, Senator, the health department is already doing an investigation into what happened here in the outbreak. What specifically are you going to be focused on during the hearing on Monday?
We're really, thanks, Anne-Marie and Vlad. We'll be focusing on everything. In the Department of Health, the commissioner has been terrific. He's been transparent in terms of all the problems that have existed and in terms of the timeline, the time frame when the very first child got sick and when the very first child passed away, and subsequently all those other children who have also died. And so it's important for the committee, and I chair the health committee, that the members and I understand exactly what happened, why it happened, and if it can be prevented. Now, this is an investigative hearing, so we're going to have the commissioner who wants to be there, experts from infection control protocol organizations. We've invited all of the ownership from Wanaque, from Voorhees, from University Hospital, where there have been other outbreaks and deaths of young children who are medically fragile. So we want to get to the bottom of all of this and find out whether or not there are, this is a human error, this is a systems error, or it's both. And I think it's both. I think there's a breakdown somewhere. This virus doesn't get spread. It's not airborne. It's droplets from individuals. And so we're talking about caregivers and nurses and others who may have been able to transmit this virus from the very first patient to now way more than a dozen, and 11 have died since at Wanaque alone.
Senator, let me share with you and our viewers a little bit of a timeline here. So on September 26th, the first sign of the virus at Wanaque facility, more than a month and a half later, that's on November 16th, you got 11 children that have died and 34 more infected. Those infected were finally separated from those who were not. It took that much time to do so. Do you feel the health department or the Wanaque facility failed these patients?
I think the Wanaque facility failed the patients. I think as soon as the department knew, they did what they had to do. Wanaque has said that they couldn't cohort, meaning separate the patients into smaller groups to prevent the spread of the virus. But there are a variety of children. I'm sorry, several children showed symptoms of upper respiratory distress, and they didn't test those children until the very first child died several days later. If I'm running that facility and I'm a professional and I see one, maybe two, and then 3, 4, 5, or 6 children become sick, you test right away because you're showing the same symptoms. It's not until the first child died did they actually test for what it was that killed that kid and the other kids that were sick. And then they announced it to the department. And then a week later, they tell the parents there was an outbreak. So this is crazy. And so there's certainly a breakdown, in not just in communication, but I think in infection protocols, not just at Wanaque, but at University Hospital, where twins just passed away yesterday because of a different virus and different complications. Now, these are medically fragile children. Anything could potentially kill them. The adenovirus will give us a common cold, maybe worst case scenario, pneumonia. But for children who are profoundly disabled, have real issues, or on ventilators, anything can kill them. And obviously, sadly, in this case, something did. And,
Senator, some of these children, these patients, they're wards of the state. Does the state bear some of the responsibility as well as the facility?
Well, they're wards of the state to the extent that, Medicaid pays for their care and the facility. But also, being ward of the state, the Department of Justice, I believe, has the legal authority and representation over them. And so this is what we're going to talk about as well, is who represents their interests, not just before all this happened, but now since it all happened.
Senator, this is an important story, but I want to switch gears for just a little bit before we let you go. You were on hand for Monday's hearing on legalizing marijuana in your state. A proposal has been attached to this legalization effort that would clear thousands of past criminal convictions, predominantly for black residents. How do you think this attachment will affect legalization in New Jersey?
Well, I think it helps. It helps gain support for those who want to vote for the bill and want to see it become law. The expungement legislation that's attached to this bill is extremely important. There's also been discussion about having a separate piece of legislation that really gets into the meat of the expungement issue. particularly individuals of color who are arrested and fined and can get a record for simple possession. And that's just something we need to just get rid of and do away with. And those protocols and procedures are just awful. I mean, it seems to me and a lot of other people that there is, in some areas of law enforcement, there's an ingrained bias toward people of color. And so when you have just as many white people smoking pot as people of color, but a higher proportion of people of color get arrested and get records because of it, you know there's a breakdown, you know there's a bias, and you know that it hurts people's futures. And so the expungement will help them in terms of going forward with their lives and getting past all those really ridiculous marijuana drug laws that have no benefit to anyone.
All right. Senator Joe Vitale, thank you, sir. We appreciate it.
My pleasure. Thank you, sir.